Hi, I'm Lesiuk. I'm going to be demoing complex wound care today. So to get started, I'm going to do hand hygiene. I have checked the doctor's orders and we know what we're going to be doing. We've collected all our supplies and we're going to then head to the patient's room. I have also asked the patient if they wanted analgesic beforehand. They said they didn't need any. So upon entering the patient's room, I'm going to do my entrance safety check. Make sure the patient's in no distress. I'm going to introduce myself. Hi, I'm Lesiuk, student nurse. I'm going to be taking care of you today. Could you tell me your first and last name? So they would verbally verify their name and I would compare that to the MAR with their wristband with the two identifiers and then ask about allergies as well. They said they have no allergies. So everything matches. So I'm going to explain the procedure. So today we're going to be doing wound care. We're going to be taking off your old dressing, assessing the wound, cleaning it, and putting on a new dressing. They're going to cooperate and are willing, so we can continue. Next, I'm going to raise the bed to appropriate waist level height and clean off our bedside table, raise that to the height too. I'm going to close the drape for privacy around the bed, and also I'm going to pull back the sheets and set up a blue pad to catch any liquid that may come about. I'm going to do hand hygiene again, and I'm going to start by opening our sterile kit. So we'll pull those corners back. Drop. Pass that to myself. Make sure that that's in the 1-inch border. We won't need that. I'm going to take out the garbage bag and I'm going to ask the patient if it's okay if I set the garbage bag up between their legs. They're okay with that. After that, I'm going to start adding. So I've got my ruler. I'm going to set that up beside the patient there. I'm going to wing back our syringe and add that to our field. Throw that in the garbage. I'm going to open up a 4x4, wing back the package and add it to our field. Throw that in the garbage. Open up our Teflon, wing it back as well. Drop that. I've got my packing gauze here, my acrylics. Open that up and we're going to let that drop onto our field. And then I'm going to add my sterile normal saline, making sure not to spill anything. And we'll set that aside. So next, I'm going to do hand hygiene. I'm going to put on clean gloves. And I'm going to start by taking off the old dressing, noting we do have a moderate amount of serosanguinous fluid on the abdominal pad. Throw that out. I'm going to take off the old 4x4s. Note that we do have a copious amount of serosanguinous fluid with no foul odor. I'm going to take my blue tweezers and pull out the old packing, noting we do have a fully saturated serosanguinous fluid on the packing, and I'll note the length as well, no foul odor. Throw that out. Next, I'm going to measure the wound. So I'm going to assess the wound now that we can see it. So we have here, the wound is about 13.5 centimeters long by 2.5 centimeters wide. I'm going to get a couple Q-tips, wing back the package, open it up, maintaining sterility, and pull out a Q-tip. I'm going to measure the depth. So here we have, it's about 2.5 centimeters in depth, and there's no signs of tunneling or undermining. We see that there is granulation tissue in the base of the wound there. There's no slough or eschar, no signs of infection, no purulent drainage. The wound edges are well approximated. Peri-wound skin is not macerated. No red, no edema. So that's good. Signs of healing. I'm going to now take my gloves off, throw those in the garbage. I'm going to do hand hygiene. And I'm going to now put on my sterile gloves at the end of the bed. I asked the patient and they said that that's okay. So I'll open up my sterile gloves here. I'm going to put on my right hand. There we go. So now I'm going to suck up about 15 ml for our cleaning of the wound. I'm going to take off our Cathlon, throw this in the sharps container. This is the needle part here. Throw that out. I'm going to attach our Cathlon to irrigate. I'm going to start from cleanest to dirtiest, so the center out, until the fluid runs clear, which it has run clear there, and then I will throw that in the garbage. So next I'm going to use my forceps, and I'm going to make this there, and I'm going to put that in the middle of the wound there to soak up the excess and let it sit. Okay. And I noticed that that has soaked up all the excess there, so now I'm going to clean the peri-wound skin. I'm going to soak some normal saline, squeeze it out, and I'm going to go from top to bottom, cleanest to dirtiest. I'm going to get another 4x4. Some normal saline, squeeze it out. On the other side, top to bottom, throw that out. And I will note that if I did get any water on the sterile field, I would start with a new one. This is drying it now, top to bottom. That's good. And top to bottom there. There we go. So now that the wound is clean, I can assess it a little bit better. The assessment is the same as what we saw before. It just looks a little bit cleaner now. There's granulation tissue, signs of healing, so that's good. The patient says that there is no pain. So now I'm going to take my packing, my Curlex, soak it, normal saline, and squeeze it out. I'm going to set it up in my hand, like so. And then I'm going to use the tweezers. And I can use my fingers there. Make sure that that's not too packed, but packed just enough so that it's not going over the borders, the wound edges there. I can throw that out. So now I'm going to put on our 4x4s over top. Now that that's on, I'm going to take my gloves off. I'm going to do hand hygiene, and I'm going to take our Mefix, which we're going to be using to cover the wound. I'm going to start with this side. Put it about like so. And the other side. Like so. After that, I'm going to ask the patient if they're doing okay, they have no pain, if they need anything else, they're okay. I'm going to make sure to lower the bed to the lowest position. I'm going to clean up all the bedside supplies. I'm going to do my exit safety check and everything that entails. I'm going to then document, when I leave the room, document on all the specifics about the wound care, what we noticed about the wound, the specific dressings that we use, the 4x4s and the Mefix, the time and how the patient handled the procedure. I'm going to document that on the IPN, Cardex, and any wound care flow sheet, and that's it.